questions, you can always let me know. Raise your hand, we can go back and review anytime. Overall, once again, guys, I told you on Friday, very, very nicely done. Great start. Question?
Yeah, I was gonna say, were any of the questions worded so that they're like similar to the registry?
Yes, they were.
Could we go over those specifically as well?
The majority of your questions were worded like the registry. So from here on out, at least the test I give you guys, we'll be doing higher level critical thinking questions. This was the easy stuff, by the way. This was the easiest test you'll probably ever have. So you get more advanced. But I am styling it after the registry because I want you to get used to what the registry is going to ask you. If we baby you, you're going to be underprepared. But if we over-prepare you, you're going to knock it out in the first try, which is the intent. For you to knock it out in one try, get out there, get your license, start working immediately. That's what we all want, right? So, trust me in this, trust your other teachers. As I always like to tell my seniors, there is a method to the madness. So please trust us, even though I know it gets frustrating, it gets difficult, and it feels like your brain's going to explode. It's all going to pay off, it's all for good reason. So hang in there with us. Let's review.
Thank you.
Let's start with number 7. This was the most missed question in the class, and it's one of those very evil multi-answer questions. Mr. Donahue's least favorite type of question, but unfortunately I have to get you guys trained on answering these type of questions because the registry loves these type of questions. So the question says, which of the following is affected when imaging patients, I didn't word that very well. Which of the following is affected when imaging patients, should say are obese, not who are obese. It says 1, image quality, 2, ability to transfer safely, and 3, ability to find positioning landmarks. The correct answer was all 3. When we have an obese patient, the image quality is going to go down quite massively because the larger amount of mass the patient has, the more pixelated the image is going to be overall. Thus, we have to mitigate that by adjusting what we call the KVP in mass. Now, you guys probably don't know what KVP mass, have y'all talked about KVP in mass at all, Mr. Fromm? You will. That's techniques we set on the machines to produce our x-rays and get a good quality image. When you have a large patient, it's going to massively affect that image quality because we have to raise those techniques up so much to counter the fact that the patient is very large. You'll learn a lot more about that next semester in PRE. Number 2, ability to transfer safely. It is very difficult to transfer obese patients safely, so that would also apply. And ability to find positioning landmarks. We did talk a bit about this as well in class. When it comes to an obese patient, you're going to have to really dig your hands in there and find those landmarks, or use alternative landmarks to find that centering point more properly. So the answer to that, guys, was 1, 2, and 3. All 3 applied. All right, this right here, this is a great example question, guys, because the answer was in the question itself. Let's read this very slowly and piece by piece. Bones are composed of an outer layer of compact bony tissue called the, it wasn't there to trick you, the compact bone. Your keyword, compact bony tissue. Now, periosteum is also on the outer layer, but that's not made of compact bony tissue. It's a very thin, veiled layer for the attachment of blood vessels. So when you're reading your questions, guys, I want y'all to get used to looking at those key words because I'm telling you a lot of times the answer is in the question itself. Don't second guess yourself and be like, oh, that's too obvious. Sometimes the most obvious answer is, well, the obvious answer is the obvious choice, guys.
That
Compact.
was from your advice that I chose compact bone.
Very good. Very good. So compact bone. Number 53, any plane passing through the body at right angles to its longitudinal axis is termed, keyword there was right angles to the longitudinal axis. Anytime you see this wording right here, guys, right angles to longitudinal axis, that's always going to apply to your axial, transverse, or horizontal plane. And I think that's what threw you guys off, is I did, if you notice, I switched the words up on you throughout the tests. Remember I told you make sure you know all 3 names? The registry, they'll be mean like that to switch it up on you to make sure you know all 3 of those names as well. So it's horizontal, axial, or transverse would all apply for that answer. Oblique is going to just be, basically, it means it's traveling at an oblique angle. That's how they'll word it. Oblique angle for oblique planes. But right angle at longitudinal axis, every time you see that, that's always going to apply to that axial body plane, or as it was worded here, horizontal. And what kind of slices does that make? Superior and inferior. Correct. Okay, that's apparently nothing on that question. That's weird. Oh, there we go. There we go. I had trouble loading. Which body habitus is shown in this figure? That's going to be your hypersthenic patient. characterized by that more horizontally shaped stomach, wider lungs, wider heart, wider intestines. As your largest body habitus, that's the hypersthenic. I think most people just confuse these two right here because they are very close in the wording. Hypersthenic versus hyposthenic. Hyper is going to be your largest body habitus. It's going to have that horizontal shape to the organs. We're going to review that again today in class as well. We're going to be talking about that in each subsequent chapter because this all is going to build on each other. Number 23, bones provide which of the following? Number 1, protection of internal organs. Number 2, production of red, white, and blood cells. And 3, attachment for the skin and fat layers. So the answer was 1 and 2 only. But why was number 3 incorrect? They don't even know why the answers are incorrect as well. Attachment for muscles, not skin and fat layers. Correct. Correct. Very good. All right, you guys did pretty well in the quadrants overall. In which quadrant of the abdomen is the appendix usually located? Where is the appendix first of all? Appendix is on the right side, the lower portion of the large intestine. So that's going to be your right lower quadrant. Right lower quadrant for the appendix. We're going to be reviewing that again as well in these next 2 chapters. It's going to keep building on itself. All right, rotation of the arm towards the midline of the body from the anatomic position is termed. It's going to be a medial rotation. Keyword there once again was rotation, guys. Rotation. That's why it wasn't pronation. Even though we're rotating to go into pronation, pronation is its own separate terminology. We're just having the palm down on the table. And the actual rotation itself is a medial or lateral rotation. So don't overthink it. I think we overthought that one a little bit again. Don't second guess yourself. Once again, a lot of times the answer is in the question itself. If it looks obvious, it usually is, guys. I'm not trying to trick you. Mr. Donahue's not that mean, I promise you. Most of the time. Wait till a year from now. I get a little more tricky. Not really. I always keep it fair. All right, this one got a lot of people here, guys. But let's think about what it's asking this question. In the anatomic position, the palms of the hands are facing forward. I want everyone to write that down and remember that because this is a registered question right here, guys. I pulled this directly from a HESI exam. In the anatomic position, the palms are facing forward. But up sounds kind of like incorrect as well, right? But why is up incorrect?
Because we're not doing
Because
this.
what does up mean? We're like this. Is this anatomic position?
Forward.
Forward and up. This is up, this is forward. Remember that question, you're gonna see that again. It's a very important, easy mistake to make.
Hieroglyphs.
Palms forward is your anatomic
They
position.
draw people like this.
In the anatomic position,
No, no.
the palms of the hands are facing forward.
Yes, like the Vitruvian man.
Forward, not up. Very easy little mistake to make.
Wait, what did you say the exam was called? Like the registry exam? Did you?
I pulled this from a HESI exam. You guys are gonna take a HESI exam in your senior year.
Oh, see, I've taken that.
You're taking HESI exams? They're tough. They're very tough. We're gonna do a
Very long,
radiology
it
version.
was very long.
But don't worry, we're gonna be so well trained by the time we get to that point, you're gonna say the HESI's, it's no problem.
Sir,
That's-
will you please help me read this? I'm not able to.
In the anatomic
the-
position.
No, sir, the correct is 69% is correct. What do you mean by point visceral, 0.09?
Oh, all this, don't worry about that, that's data for me. That doesn't apply to you.
Okay.
It just lets me know if it was a hard question, an easy question, that's statistics, don't worry about that. It's not for you guys.
Do we have to pass the HESI test
Your didactic capstone is basically a HESI exam,
Oh.
yes.
So that's what you call HESI, the didactic capstone, or is that 2 different tests?
It's basically the same thing.
Well, we
But you have to take it
The
twice.
didactic capstone is a HESI exam,
Sir, if
yes.
you've already done the HACI, then it's okay. for you?
This is a different HESI, this is for radiologic technology,
Oh,
this
I
is for
see.
X-ray.
So we take it here, we wouldn't have.
No, it'll be here, I'll provide it for you guys, yeah. I've got like 10 HESI exams, don't worry, got lots of them. I'll put them all in here, they're already in here.
This week made it up.
No, I actually got the actual questions.
Oh.
Yeah. I didn't make anything up.
Or you know how like when you take the HESI test, you have to go to like, center or whatever?
I have resources to acquire.
So it's the same board
actual
of
exams, so I've got about 7 or 8 HESI exams I put into the exam songs, so
Oh, so that's where you get your questions.
That's where I get a lot, that's why I'm gonna have a lot of questions for you guys to practice on, because you're gonna get the real, actual questions to practice with.
So it's the same board, Hasty, that makes questions for only the radiology things.
No, so that's a common misconception.
I see.
The actual test is made by the ARRT,
see.
but the HESI, even though it's made by a different company, the HESI over prepares you for the ART, because the HESI is very difficult. It requires critical thinking, but that trains you to do even better on the actual ART exam. So there's a good reason to take HESI level questions. Why I keep telling you guys we're doing brain training, right?
Mm-hmm.
We're training our brains to take higher level tests, because the ART is modeling their tests after those HESI type questions, being the higher critical thinking type questions. So that's why we're doing it. Next question, number 4. The standards of ethics for radiographers was written and is maintained by, speaking of ARRT, that was the answer, the ARRT, the American Institute of Radiologic Technology. Even though they formulate the tests and the questions, guys, they also are in charge of standards of ethics. Very important thing to remember, because people always forget that portion of ARRT. We all just think they make the exams and that's it. They're also in charge of those ethics. So write that down, remember that. You're probably going to see that again. Make sure you know the difference between ARRT, ASRT, and JCERT. You gotta know the difference between those 3 organizations. They will give you at least one of those questions on your board exam. Be careful on that.
Sir, sorry, because I'm really confused with this. ARRT is this is for
They're the ones that are in charge of the standard of ethics and creating the board exams. The ASRT creates the curriculum of which we teach, and the JCERT is in charge of our accreditation process for the schools. Also ASRT, and this is where I think we probably mix these up on the test. ASRT not only does the curriculum, but they're also in charge of the practice standards. So ART, standard of ethics, examinations, ASRT, curriculum, and practice standards. And then JCERT, once again, accreditation. You know the difference between those 3 organizations. Alright, so I'm gonna skip forward a little bit on these ones that are marked red. That means they were more difficult for the class. Turning the forearms at the palm of the hand is up. Is termed supination. Supination. We supinate the hand when we put it straight forward and the palm is up. That's supination. What's the reverse? Pronation. Pronation. Number 58. The patient in this figure is in which position? So you were asked to name the actual specific position. Left side is down, is the anterior surface, thus it is an LAO, left anterior oblique. You guys actually did very well in these obliques. I was proud of you on this test. Your position, you guys nailed pretty well. But do we see why that's an LAO? See how his left side's down, his right side's up? And it's the anterior surface closest to the IR. That's why it's an LAO, or left anterior oblique. Let's see. Into how many regions is the abdomen divided? We did get a couple people, so 9 regions, 4 quadrants. Remember I said to know the 4 quadrants specifically, but know that there also are 9 regions in number. So 9 regions and 4 quadrants. Approximately what percentage of the population has a sthenic body habitus? That is the greatest of the population. The greatest percentage of population, that is 50% of the world's population. What fits into 35%? What about 10? Asthenic, and then 5? Hypersthenic.
Could you repeat the question? Oh,
Yes.
sorry.
Yep, good. All right, movement of a part away from the central axis of the body or body part is termed an abduction. Not an alien abduction, but our arm or legs abducting away from the midline of the body. Same concept, it's moving away from the source. Away from the source. The reverse is adduction. Adduction. The term used to describe the sole of the foot. Plantar surface. The top of the foot would be dorsal surface. Very good. Which of the following is incorrect regarding anatomic markers? digital marker is acceptable on portal exams only. Are digital markers ever acceptable?
No.
Well, what if your tech, who's the best tech that God ever created, is using digital markers in the clinic? And he says, I like that, that's her. If they say they're the best tech that ever walked this earth and they're using digital markers, is it okay? Is it ever okay to use digital markers?
No.
Right, and I'm saying that because for some reason people still want to argue that fact. This is a registry question. They still ask that question. You never ever use digital markers, period, according to the curriculum. Even though you'll see a lot of text, and I myself have used digital markers as well. So has Miss Bonilla. Even though we do that, it's technically not acceptable per the curriculum that you're learning.
So my question to you is, why would you choose to use the marker? Is it easier to use the digital marker, or because you forgot it?
I'll give you a great example. I just shot an X-ray on a pediatric patient. It was very difficult. Pediatrics are susceptible to a lot of radiation effects. Do I want to repeat that image? No. So I'm going to put a digital marker, even though my marker wasn't on there, for the best practice of the patient. And plus, the image is perfect. There's no reason to repeat it. But even though I'm doing that, and that makes common sense, per the registry and per the curriculum, they'd say, yeah, you should repeat that because you should always have an anatomical physical marker. So there's a little gray area. I'm not going to say any more than that.
So, well, because you might have forgotten to put it in the first place.
Right, so as you forget, you're working fast or your marker falls
But
off.
the
Sometimes it
baby's
falls
also
off.
troublesome also, they're crying.
Right, sometimes it falls off the cassette. Sometimes you just forgot it in the department. You're doing a portal and you forgot your markers. You're not going to go all the way back down there and get your marker. You got a job to do. It's a stat. They're critical. It's code red, code blue. You got to do it fast. Of course, you're going to put a digital marker. That's common sense. But once again, common sense does not score well on your registry. What their curriculum says is what you go with. That's why I'm reviewing that. Per the registry, you never use digital markers, period. Even if they give you a scenario like I just gave you, that you're in a critical care center and the patient's going code blue and you forgot your marker, according to ART, you still need a physical marker. Does that make sense? So I just want to make sure it's clear because you're going to see a lot of that in clinic where they're using digital markers, that per your curriculum, that's not allowed. You got that?
Yes, sir.
Just making sure. So people still argue with me. I got seniors still arguing, but so-and-so did the, I don't care what so-and-so did. That's going to give you they're going to mark you off on your registry if you put that you use digital markers. They want the physical ones, even though it's against common sense. Does that make sense? Well, that joke went nowhere. Okay, and we all scored well on these. The bonus question. 75% of the class got the bonus question correct. That means you guys read well in your notes, so very nicely done. Bonus, what joint classification does the distal tibiofibular joint fall under? That was the syndesmosis joint. Very good, very good. That gave you an extra point on your test.
So did we know that this was the bonus question in the test?
Yeah, it tells you right here, look.
Oh,
Always put the word bonus in front of it. Now, everyone had a randomized test, so you may have gotten your bonus question early. Some of you may have it later. Keep that in mind in case you have wandering eyes. Anyone have wandering eyes in here? You probably don't want to wander your eyes to the person next to you because their test is different from yours. And their 31 is different from your 31. I always randomize the questions and I randomize the answer choices. So their answer choices, even if you're on the same question, are going to be different from yours. So I'm not accusing anybody of looking at anyone else's test. But I'm saying if you happen to have wandering eyes, that's not going to be the best practice moving forward because everyone's test is different. So do keep that in mind.
We have a wandering camera.
And we have a camera watching you back here as well. Did you guys know
That's a
that?
camera?
There's a camera in the back of the
But why
room.
would you be bothered if the exam is different, if the wandering eye?
Is she talking about this?
What now?
Why
Is
would
he
you be
talking about this
bothered if the
video?
exam
No,
is
good then.
different? If you're looking around, why should it? Why
I thought
should
that was a projector.
I'll tell you why, because good practice is not to look over, because if the registry sees you trying to look over, they're going to throw you out of there and you're not going to get to take your exam. You're gonna
even
automatically fail.
even the exam is different. That's even then.
Yes, we gotta learn to focus on our screen. They will not mess around with that either. If they see you looking even to the left a little bit, they're gonna come tap you on the shoulder and say, hey, what you looking at? Do that again, you're out of here. Question?
That first question on the test, so compact, it's a compact bone. It says tissue.
it's still compact bony tissue. It's considered tissue, yes. Compact bony tissue specifically, yes. Any more questions, guys? Any more questions that you would like to review or look at? If you look at your results, or anything you want me to go over before we move on?
You said today we're gonna go over the habit as a group.
Yes, we are.
So please, if you can give the to remember ART and ARST and J.
So ART is in charge of the code of ethics and the development of your board exams. ASRT is in charge of the standards of care, as well as your curriculum. And JRCERT, or JCERT, is in charge of accreditation. All right, but really strong turnout, guys. Please do not lower the bar, because this is the easiest test you'll have. It's going to get more intense, and today, as you'll see, we're going to jump into anatomy today. Anatomy is a lot of memorization. It's a lot of terminology to learn. We typically, at each chapter, we'll start with anatomy, and then we'll get to how we position to look at that anatomy on the x-rays. And then we're going to go over what's called evaluation criteria of what we want to see on the x-rays. So every chapter from now on will be comprised of 4 main parts. That's the anatomy, pathology, the positioning, and then what we call the evaluation criteria of the x-rays. So we're about to start chapter 3. Before we do that, take 10 minutes, get you some coffee, water, stretch, because we're about to hit the ground running.
Oh, coffee.
And it's going to be a lot